A 44-year-old woman underwent a modified radical mastectomy for left breast carcinoma. Nothing is keyword here. Histology is as shown below. Immunohistochemistry shows ER positive. Okay, it is ER positive, PR positive, and HER2/neu negative. HER2/neu negative and a high Ki67 index. High Ki67 index. Which of the following is the most appropriate diagnosis? So important, sir, these classification of the breast carcinoma. So the gene expression profiling classification of breast carcinoma. So we will divide it based on ER, PR and HER2/neu. ER, PR and HER2/neu. So first is ER positive, PR positive, ER positive, PR positive, and ER negative, PR negative. ER negative, PR negative. So we are looking for ER. Those which arise from ER are luminal. So remember, ER positivity means, ER positivity, let me just tell you, is slow proliferating, usually slow proliferating, or we can say better, ER positivity is usually well differentiated, I would say, is well differentiated and will be chemo resistant. Will be chemo resistant. Well differentiated and chemo resistant. Whereas ER negativity is poorly differentiated usually, but chemo sensitive. And this will be very aggressive tumors. ER negative will be aggressive tumors. ER positive will be less aggressive usually. Less aggressive. Now, so if the tumor is ER and PR positive, then next is check for HER2/neu in both of them. Check for HER2/neu in both of them. HER2/neu could be positive or negative. HER2/neu could be positive or negative. HER2/neu could be positive or negative. HER2/neu is associated, positivity is associated with aggressive. Tumor will be aggressive, HER2/neu positivity. So, so this tumor comes to be ER negative, PR negative, HER2/neu positive. This will be ER negative, PR negative, HER2/neu negative. Right? This is called as basal-like. Basal-like. This is called as HER2/neu enriched. HER2/neu enriched. HER2/neu enriched. Basal-like, HER2/neu enriched. Now, the one which are HER2/neu positive, this will be ER positive, PR positive, and HER2 positive. This is called luminal B type. Luminal B type. So this will be your ER positive, PR positive, and HER2/neu negative. In this, look for Ki67. Ki67 is low or high. Ki67 index we are checking. If Ki67 index is high, this will also be called as a luminal B. If it is a low, that will be called as a luminal A. Luminal A. So you are having 4 important classes of breast carcinomas now. Luminal A, luminal B, HER2/neu enriched, and basal-like breast carcinoma. Basal-like breast carcinoma. Luminal A, luminal B, HER2/neu enriched, and basal-like. Now, just to understand, all these 3 tumors are aggressive tumors. All these 3 tumors are, they have similar features. Let us write common features between them. Okay, so this is aggressive, aggressive, and aggressive. What do I mean by aggressive? Rapidly proliferating, usually aggressive tumor. But whereas luminal A is less aggressive, or very mild aggression is there. Less aggressive. Right? Next is your luminal A is chemo resistant. Luminal B is also chemo resistant. Why? Because ER positive is equal to chemo resistance we discussed before. ER positivity is chemo resistant. So luminal B is also chemo resistant. Now look at this. Luminal A was chemo resistant, but still prognosis will be good. Why? Because it is not aggressive. This is a very aggressive tumor, but chemo resistant. Whereas this is aggressive, but not chemo resistant. So this will be, okay. So let us look at this. This will be chemo sensitive tumor. This will also be chemo sensitive tumor. Chemo sensitive. These are all these are aggressive, but the one is not chemosensitive at all. And in fact, the last type, that is this will be very aggressive, highly aggressive tumor. High aggression is there. Chemo sensitivity is there, but it is very aggressive tumor. Now, so this is also highly aggressive. Which one? Your HER2 enriched is also highly aggressive. It is chemosensitive and it also responds to trastuzumab. Because of this, prognosis becomes good. So let us talk about the prognosis now. The prognosis, the best prognosis is luminal A. Luminal A has best prognosis because there is a very less chance of relapse. Median relapse time is 10 to 15 years here, more than 10 years basically. So relapse happens very, very rarely in luminal A, right? Whereas your basal is the worst prognosis. Relapse usually happens within first 5 years of surgery. Basically, this luminal A, everything is because of for adjuvant therapy we are doing, adjuvant chemotherapy, right? So here we give chemo, but the tumor is aggressive and they will not respond to trastuzumab. That's why they are worst. Whereas these are poor prognostic. Luminal B are poor prognostic. Why they are poor prognostic, sir? They are poor prognostic because they are aggressive and not chemo sensitive. They are chemo resistant. These are good prognostic with trastuzumab and chemo. So although these are highly aggressive, but their prognosis is better because they are chemosensitive and also they respond to trastuzumab. Whereas these are poor prognosis, remember. Okay. Yes. So what is the answer to our question here? What is the question asked? What is this? Okay, let us look. ER positive, PR positive, HER2 negative, Ki67 is high. This will be luminal B type. Luminal B type. This is a luminal B, correct? Yes, you're right. Luminal B type. So answer to this, invasive ductal carcinoma, luminal B. Option D is the correct answer here.